The other peptide that I wanted to talk to you about is PT141. This is a very exciting peptide. This one just got FDA approval by for treatment of women with hyposexual desire disorder. It's called, and it's actually approved for women, but also has benefits in men. But primarily in women, it's been found that the women that have this hyposexual desire or low libido, this is even with having a good relationship, even with having hormone balance, which we always look for initially with the patients, make sure their hormones are balanced. That has a lot to do with hyposexual desire, and to make sure that it's not produced by side effects from certain medications. As we've talked also in the past, certain medications or antidepressants can help you with depression, but can decrease your sexual desire. And so it's contraindicated in a couple of patients. So have patients call the office. We're going to run a special promotion where we can tell you if you're a candidate for these type of therapies, and we can definitely give you some more information on how to use them, cost, and who's appropriate for this type of therapy. The way it works is it actually, in women with this hyposexual desire disorder, they have a deficiency in neurotransmitters, and so they don't stimulate certain parts of the brain that are the sexual desire, centers in the brain, and so they don't get turned on. And there's some receptors called melanocortin receptors that are turned on with this PT141. Remember, lock and key. So basically, it turns on these receptors, and it turns on these areas of the brain that cause improved libido or more sexual desire. Again, with minimal side effects. So it's very well shown to help women in that resource. In men, it's been shown to help with better erections. Men usually don't have as much of a problem with their hyposexual desire as women do, because in men it's more controlled with hormones like testosterone. In women it's more complicated, but in men it's been shown to help with erections. Especially for men that tried Viagra and they're not getting the full results, their full benefits from Viagra. This adds another area that helps the Viagra work better, helps with circulation, helps with the desire, and men also have issues with low desire due to stress, fatigue. Some guys are overworked, and this will help men too. And they just the way it works is you do the injection maybe 45 minutes before the act of having sexual intercourse, and it just heightens everything. Makes everything more pleasurable for both the men and the female. But right now it's FDA approved mostly for women.